Suppose you're a woman over 60 living in the US, and you've noticed your legs feeling weaker, your balance slipping when going downstairs, or perhaps you've started fearing the simple act of getting up from a chair alone. In that case, this is the one video you absolutely don't want to miss. I'm Dr. Emily Carter, a physician specializing in senior health for over 20 years, and today, I'll walk you through 5 simple yet incredibly effective exercises designed specifically for women over 60 to help you maintain independence, build strength, improve balance, and activate full body circulation, all from the comfort of your own home. No gym required, no expensive equipment, no risky movements, just proven, science-backed methods that are safe, easy to follow, and tailored to the unique needs of aging joints, muscles, and energy levels. And if you've watched fitness videos on YouTube before but felt overwhelmed or thought, this isn't made for people my age, then stay with me until the end, because I'm not just demonstrating these exercises step by step, I'll also be giving you critical medical tips along the way that most other videos overlook. Drop a comment below that says, "I'm ready," if you're committed to taking action for your health starting today. Hit subscribe, and let's begin. Because your body deserves the very best care after 60. When you cross the age of 60, your body begins to change in ways many don't notice, until one day, you find yourself rising more slowly, feeling unsteady, and struggling with what used to be simple, like climbing a few stairs. The cause isn't just aging, it's muscle loss and declining functional strength that quietly chip away at your independence every year. Studies from the Journal of Gerontology and the National Institutes of Health reveal that women over 60 can lose 1.5% to 2.5% of muscle mass and strength per year, particularly in the legs and hips. These muscle groups directly affect walking, standing, and staying independent. As these muscles weaken, circulation slows, reflexes decline, and your risk of falling increases by up to 30%. But here's the good news. This decline is not inevitable. It's reversible. A study in the Journal of Physical Therapy Science, 2016, showed that performing simple strength and balance exercises just 3 times per week can reduce fall risk by 32% and significantly improve mobility in as little as 6 weeks. That's why I want you to remember these 5 golden rules before we start. First, always warm up for 5 to 10 minutes to loosen up muscles and joints. Second, start slow and with control. Focus on technique over speed. Third, breathe normally. Never hold your breath, as it can cause sudden spikes in blood pressure. Fourth, aim to train at least 2 to 3 times per week, alternating strength, balance, and circulation-focused exercises. And finally, listen to your body. If you feel dizzy, joint pain, or a racing heartbeat, stop immediately and check with your doctor. The exercises I'm about to show you won't just make you stronger. They'll help you preserve your independence, restore your confidence, and regain control over your daily life. No medication or supplement can do what regular smart movement can. Let's get started with the very first exercise. 1. Sit to stand. The first exercise, sit to stand, is one of the most basic yet powerful movements to restore lower body strength in women over 60. You might think it's just standing up and sitting down, but for me, and for hundreds of older patients I've worked with, this is a real-life test of your ability to stay independent, move safely, and prevent falls in everyday life. According to a study published in the Journal of Aging and Health, the speed and ease with which seniors can perform the sit-to-stand exercise directly correlate with overall mobility and independent living capacity. If you can do it smoothly, you're maintaining strong control over your body. But if you need to push off with your hands or struggle to rise slowly, it's a sign that your thighs, hips, and glutes are weakening, and that directly impacts your ability to walk, climb stairs, or simply stand up from the bathtub. Start by sitting on a sturdy chair. No wheels, at knee height or slightly higher. Place your feet shoulder-width apart, keep your back straight, and either cross your arms in front of your chest or rest them lightly on your thighs for support. Now slowly rise over 2 to 3 seconds, keeping your knees straight but not locked. Then gently lower yourself back down over another 2 to 3 seconds. Repeat 8 to 10 times, rest briefly, then complete 1 to 2 more sets, depending on your energy level. The key here isn't speed, it's control and technique. According to the Journals of Gerontology, Medical Sciences, practicing sit-to-stand just 3 times per week for 6 weeks significantly improves lower limb strength and flexibility, and can reduce sit-to-stand time by an average of 1.5 seconds, a small number that could mean the difference between catching yourself or falling in a real-life situation. And if you're dealing with knee pain or osteoporosis, don't worry. You can start with a higher chair or use light hand support. What matters most is that you start today, because this simple movement is the first step in rebuilding your foundation of strength, independence, and confidence. 2. Single leg stand. The second exercise, single leg stand, is one of the most important movements to improve balance, enhance neuromuscular reflexes, and reduce fall risk for women over 60. It may look simple, but this is a powerful indicator of how well your body can stay stable in unpredictable situations, like when you trip, slip, or have to quickly change direction while walking. Research published in the Archives of Gerontology and Geriatrics, 2014, found that adults who cannot balance on one leg for at least 5 seconds are significantly more likely to experience falls, loss of functional mobility, and even early mortality. On the other hand, improving your single leg balance to just 15 to 30 seconds a day has been shown to reduce the risk of serious falls by up to 36%, according to the Journal of Geriatric Physical Therapy. To perform this exercise, stand near a sturdy wall or chair that you can use for support if needed. Stand tall with both feet hip-width apart. Gently lift your right foot about 2 to 4 inches off the ground, keeping the knee slightly bent. Breathe steadily and hold the position for 10 to 20 seconds, then switch sides. Repeat 3 to 5 times per leg. Once you feel stable, you can increase the hold time to 30 seconds, or even challenge yourself by closing your eyes, but only if you're close to a secure support point. This exercise activates dozens of small stabilizing muscles in your ankles, knees, and hips, muscles that tend to weaken with age but are vital for everyday stability. It also enhances communication between your brain and body, improving reaction time when facing a loss of balance. If you've had a fall before, experienced dizziness, or are taking medications that affect balance, always practice near a support surface and don't push beyond your comfort zone. But remember, this one small daily practice can bring about a huge improvement in your confidence, stability, and ability to live independently as you age. This exercise activates a wide range of small stabilizing muscles in your feet, ankles, knees, and hips, areas that are often overlooked but are absolutely essential for maintaining your body's central alignment and postural stability. In addition, it enhances neuromuscular coordination, helping your brain and muscles communicate more efficiently so you can react faster when faced with sudden changes or unexpected obstacles in daily life. If you've ever experienced a fall, have a history of dizziness, or are taking medications that affect balance, always perform this exercise near a stable support and never close your eyes until you feel completely confident. But remember this, a simple, static movement, like standing on one leg, if practiced consistently, can lead to dramatic improvements in your balance, confidence, and overall independence after age 60. 3. Lateral step with side lunge. The third exercise, lateral step with side lunges, is one of the most effective movements for women over 60 to build hip strength, improve dynamic balance, and maintain the flexibility needed for side-to-side movement or obstacle avoidance in real-life settings. Many older adults focus only on walking forward, forgetting that most real-world falls happen during lateral movement, like stepping sideways, turning abruptly, or shifting direction quickly. According to research from the Journal of Geriatric Physical Therapy, exercises involving lateral motion significantly improve postural reaction time and balance response, while also reducing fall risk in everyday environments. Here's how to perform it. Stand tall with your feet hip-width apart. Raise your arms slightly in front of you for balance. Take a step to the right, about 12 to 16 inches, 30 to 40 centimeters. As your right foot lands, bend your right knee into a shallow lunge. Imagine sitting lightly into an invisible chair. Keep your left leg straight or slightly bent. Shift your hips gently backward to maintain alignment. Hold for 1-2 seconds, then press through your right heel to return to the starting position. Repeat on the left side. Perform 8 to 10 reps per side, resting 30 to 60 seconds between sets, for a total of 2 full sets. This exercise strongly activates your gluteus medius, outer thigh muscles, and knee stabilizers, muscle groups essential for maintaining control when you step laterally or change direction. According to the Gait and Posture Journal, strengthening the hip complex dramatically reduces balance impairments and improves walking speed in older women. If you have knee or hip joint discomfort, start with a smaller step and shallower lunge, adjusting to a range that feels safe and comfortable. Always keep your back straight and avoid leaning forward. Though the movement is simple, its impact is profound, helping you stay steady, self-reliant, and safe, especially when living alone or navigating tight or slippery spaces. This is a go-to exercise I recommend for nearly all of my older patients because it trains real-world independence in the most practical, meaningful way. 4. Squat. The fourth exercise, squat, is what I call the golden foundation movement, essential for restoring leg strength, glute power, and functional independence in women over 60. Even if you've never been to a gym, I want you to try this one because it's not just another fitness move. It's a vital life motion pattern that allows you to stand up from bed, step onto a curb, or lift your grandchild safely and confidently. According to the Journal of Strength and Conditioning Research, the squat is the most effective exercise for strengthening the lower body muscle groups, while also improving bone density in the hips and thighs, the two areas most vulnerable to osteoporosis in postmenopausal women. Additionally, a study published in the American Journal of Physical Medicine and Rehabilitation confirmed that performing squats 3 times a week for 8 weeks can significantly boost leg strength and reduce the time needed to perform daily functional tasks like standing up from a chair by as much as 18%. To begin, stand tall with your feet shoulder-width apart and toes slightly turned outward. Keep your back straight, eyes forward, and bring your arms forward at chest level for balance. Slowly push your hips backward and lower yourself as if you're sitting into an invisible chair. Hold for 2 to 3 seconds, ensuring your knees don't pass your toes and that your weight stays on your heels. Then, press through your heels to rise back up over 2 to 3 seconds. Perform 10 repetitions in one set. Rest for 30 to 45 seconds and complete 2 sets depending on your comfort level. If your knees feel weak or you have advanced osteoporosis, start with a half squat, only lowering halfway down, or place a chair behind you so you can touch it lightly before standing back up. The goal isn't depth or speed, but control and stability. The squat not only strengthens your legs and hips, but also enhances blood circulation, reduces numbness and stiffness from prolonged sitting, and stabilizes the hip region, which tends to weaken with age. This is one of the cornerstone exercises I recommend to nearly all my older female patients. With just a few weeks of consistent practice, you'll notice yourself standing up more easily, climbing stairs with confidence, and feeling a renewed sense of vitality. Best of all, you can do it right at home. No equipment, no assistance needed, just your body and your commitment. 5. Trunk twist plus back leg raise. The fifth exercise combines trunk twist and back leg raise, two gentle yet incredibly effective movements for improving spinal flexibility, boosting blood circulation in the hips and lower back, and enhancing dynamic balance and core control for women over 60. These are everyday movements, twisting to grab something, reaching for an item on a high shelf, or stepping backward in the kitchen. Yet as we age, these actions can become risky, leading to muscle strain or loss of balance if not trained regularly. Start with trunk twist. Stand upright with your feet shoulder-width apart and your hands resting lightly on your hips or raised to shoulder level. Slowly rotate your torso to the right until you feel a gentle stretch in your waist and lower back. Hold for 1-2 seconds. then rotate to the left. Repeat 10 times on each side, breathing steadily and moving slowly. This movement stretches the intercostal muscles, obliques, and lower back muscles, areas that often become frozen due to prolonged sitting or inactivity. According to the Journal of Bodywork and Movement Therapies, performing trunk rotations regularly can improve spinal mobility and reduce chronic lower back pain by up to 31% in older adults. Afterward, continue with back leg raise, detailed next in the video, to activate the glutes and improve postural balance, completing the perfect pair for a strong, mobile, and independent body after 60. Immediately after, move into the back leg raise. Stand beside a sturdy chair or wall for support. Slowly lift your right leg straight back, keeping the knee extended but not locked. Hold for 1 to 2 seconds, then lower it with control. Repeat 10 times per leg, then switch sides. This exercise primarily activates the gluteus maximus, hamstrings, and the hip stabilizers, muscle groups that are critical for maintaining posture, balance, and strength in the lower body. According to a study published in Clinical Interventions in Aging, strengthening the glutes and lower back is closely associated with improved standing endurance, longer walking distances, and reduced risk of backward falls in older women. If you have a history of lower back pain, rotate your torso only within a comfortable range. Never force the movement. When lifting the leg, avoid arching your back or leaning forward too much. Instead, gently engage your core muscles to keep your spine stable and aligned. The combination of trunk rotation and leg extension doesn't just promote blood flow to the hips and lower back. It also helps you retain flexibility and functional independence as you transition through your 60s and beyond. I often place this movement at the end of a workout session, like a gentle wake-up call for the full musculoskeletal system. Light, safe, and remarkably effective over time. If you're starting an exercise routine after age 60, congratulations! You've taken the first step on one of the most important journeys of your life, reclaiming your strength, autonomy, and quality of life. But starting correctly is crucial, because after 60, your body recovers more slowly and is more vulnerable to injury if exercises are done improperly or with excessive effort. First, my advice is this: start slowly, but start today. In your first week, choose just 2 to 3 gentle exercises, performing each for 1 to 2 sets. Prioritize movements that help you reconnect with your body, like the sit-to-stand and single-leg stand. According to the Journal of Aging and Physical Activity, establishing a regular frequency in the first week of training can increase adherence to a long-term routine by up to 40% after 3 months. Second, track your daily progress. Note which exercises you did, how many reps, and how you felt afterward. This not only helps you recognize improvements, but also gives your doctor or physical therapist valuable insight should any issues arise. Also, try to choose a consistent time each day, ideally in the morning, so your body forms a natural, repeatable exercise rhythm. For postmenopausal women, especially those diagnosed with osteoporosis or joint degeneration, avoid forceful twisting, deep forward bending, or high-impact exercises. The Journal of Bone and Mineral Research reports that women over 60 experience a 1% decline in bone density each year, making improper form a real risk factor for microfractures in the hip and spine. Always prioritize correct posture, slow controlled movements, and use support whenever necessary. And finally, a few absolute don'ts. Do not exercise right after a full meal. Do not skip warm-ups and cool-downs. And above all, do not push beyond your limits. If you experience dizziness, lingering joint pain, abnormally rapid heart rate, or shortness of breath during exercise, that's your body's signal to rest or seek medical guidance. Remember, after 60, consistency beats intensity, and safety is the foundation of sustainable progress. Exercising after 60 is not about competition. It's about rebuilding a positive, lasting relationship between you and your body. One that is sustainable, safe, and energizing for the years to come. And I'm here to walk that path with you. You've just completed 5 simple yet highly effective exercises designed specifically for women over 60. Movements that enhance muscle strength, postural balance, whole body circulation, and most importantly, help you maintain independence in everyday life. These exercises are not only supported by my clinical experience, but also validated by research from reputable sources, including the Journal of Geriatric Physical Therapy and the National Institute on Aging. This research shows that regular exercise after age 60 can reduce the risk of falling by up to 36% and significantly improve mobility within just 6 weeks. If you're already feeling lighter on your feet, standing up more easily, or simply experiencing a lift in your mood after today's session, congratulations! You're doing it right. And if you're ready to commit to your health journey, comment below. I'm starting today. That way, and our entire Senior Health Zone community can support you every step of the way. Don't forget to hit subscribe and turn on the notification bell so you never miss a new routine to stay strong, mobile, and vibrant with Senior Health Zone. I'm Dr. Emily Carter. See you in the next video.